Hello and welcome. My name is Ellen Kittredge, and I'm so excited to be here with you today. Thank you all for coming live to this call. This call will be recorded and be available for viewing, and really looking forward to those of you who are listening to the replay. I hope you enjoy the call as well and get a lot from this. I'm so thrilled. This is a very, very special moment here to have one of the clinical team from Microbiome Labs here presenting to you all. There's a lot of amazing information about the female microbiome that is still relatively new. It's a relatively new area of research and exploration, so this is a lot of breaking news information that you all are going to get for the first time. So I think most of you know me, but for those who don't, I am a nutritional counselor and health coach. I've been in business for 17 years doing this work. Absolutely love helping people to feel better and optimize their health in all ways. And I've been very specifically focusing on the gut microbiome and also the vaginal microbiome more recently for the last 3 years. And I've been working this whole time with my lovely rep from Microbiome Labs, Ben Myers. So I wanted to just say thank you, Ben, for all of the wonderful email support that you've given and the many times you've taken care of problems that my clients have had. I'm super grateful for your support. And I wanted to ask you if you would introduce us to Sarah. Say a little bit about yourself and introduce us to Sarah, who'll be doing the call today.
Absolutely. It's been my pleasure, Ellen. I've been with Microbiome Lab for 5 years, and working with Ellen has been one of the highlights. I am, for just so I'm not a random face, you're not saying, I'm the territory manager here in New England, living in Boston, that works with all the accounts in my area. Ellen is one of my favorites and one of Microbiome Lab's favorites. She'll probably be a little hesitant, but she actually was a winner of our Pioneer Award from Microbiome Labs, one of 20 in the world. So we're very happy and wanted to congratulate her here in front of her clients, so they know how great of a person they've picked on their health journey. And I also get to introduce Sarah. So I'm the rep here in New England, but Sarah's with our clinical science team. I don't come through and do the education and go through all the data and all the research, but Sarah is an expert at does. And so I want to introduce her. Her name's Sarah Harrington. She is a clinical science liaison and biome effects consultant at Microbiome Labs with over 10 years of combined experience in clinical practice and patient education. She combines the scientific evidence with realistic application for practitioners and patients. She holds a master's degree in clinical nutrition from Sonora University in Health Sciences and is a certified nutrition specialist through the American Nutrition Association. During her career, she has specialized in the areas of oncology, chronic inflammatory disease, athletic performance, and gastrointestinal health. Sarah Harrington, welcome to the room. I'm going to hand over to you, and I'm looking forward to probably as much as everybody else in the room listening to everything you're going to educate us with today.
Thank you so much for that introduction, Ben. Just give me one moment while I get my screen shared here. All right. Can everybody see that okay? Thumbs up. Great, okay. Wonderful. All right. Well, hello, everyone. Thank you so much for tuning in to our chat today. I'm really honored to have the chance to speak with you and to share some insights on optimizing the female microbiome to improve our female health outcomes. So like Ellen mentioned, if you have questions on something that I say throughout the webinar that you want some clarification on, you are more than welcome to just pop those questions right into the chat. But we will also do a live Q&A at the end. So you're welcome to save your questions for then as well. So I know your time is very valuable. And once again, we really appreciate you tuning in. But I would like to dive right in because we have a lot to cover today. All right, so I want to start with this. And some of you may be familiar with Amy Schumer, actress and comedian. She has been speaking out publicly recently regarding her diagnoses of both endometriosis and hyperemesis gravidarum. And if you don't know what that is, it's basically cyclical vomiting throughout the entire course of pregnancy. So she made the following comments while discussing her experience. I was so happy to be diagnosed because I was like, okay, what do we do? You know, that now that we know what it is, what do people do? And they, being her care team, her doctors, said, oh, well, we haven't really been able to study it because it only happens to women. Now, this was met with a laugh by the audience, and it was delivered with humor, but this is the unfortunate reality of so many women. Not only has there been a disparity in research regarding women's health conditions, but in a study conducted just this year in 2025 of 1,000 women, 9 out of 10 of us were embarrassed to say the word vagina, even in front of our physicians. So the conversation around vaginal health and how it can kind of improve female health outcomes is one that I'm really excited to have with you today. And hopefully you come away with some empowering information for either yourself or someone that you know. But first, to start off, let's actually get to know the vaginal microbiome. So just like in our digestive system, the vagina has a unique population of microorganisms that support many aspects of a woman's health and well-being. So if you're familiar with the gut microbiome, you've probably heard that here we want to see a really high level of diversity, right? We want to see a lot of different species of bacteria. So this ecology is very similar to kind of like a jungle. This is not the case for the vaginal microbiome. In the vaginal microbiome, we want to see a little bit more of a desert. We want a low level of diversity. And specifically, we want to see an abundance of one species in particular, Lactobacillus. Lactobacillus has numerous protective benefits for vaginal health, such as helping to reduce pathogens. It also contributes to the vaginal microbiome having a very low pH, which is caused by the production of something called lactic acid, which these Lactobacillus species create. Now, in particular, a healthy vaginal microenvironment is associated with the presence of 4 strains in particular, or 4 species in particular. Lactobacillus crispatus, L. gasseri, L. jensenii, and L. einers. And these may be present in different ratios, and we'll kind of get into what these actually could look like and what these distributions could actually look like here in a few slides. So this is a schematic just to help us actually visualize what a healthy vaginal microbiome is going to actually look like. So we're going to have a thick vaginal epithelium, which is basically that outer layer of cells. And then we have a thick mucosal layer that is protecting this layer of cells. We're going to have a dominance of these Lactobacillus species, and these create a variety of antimicrobial peptides. A couple of these are bacteriocins as well as hydrogen peroxide. These play a really important role because they inhibit the adhesion and growth of pathogens or opportunistic bacteria in the vaginal microenvironment. So we're also going to get that production of lactic acid from the Lactobacillus. We're going to have that low pH from the lactic acid. And then estrogen. Estrogen is going to play a pretty big role in the vaginal microbiome because estrogen creates something called glycogen. And glycogen is kind of the substrate fuel, the food for these healthy lactobacillus. And we'll circle back to that here in a little bit because that is a really important topic for us to go over as well. Then here we have a dysbiotic vaginal environment. So this one probably isn't going to be the healthiest environment. We have a low abundance of those lactobacillus species. Maybe we don't even have any present at all. So we're not going to get the production of these healthy antimicrobials. So there's a higher risk that pathogens, opportunistic bacteria, things we don't want, living in this environment are going to be able to live and to thrive. And this is associated with numerous complications, such as bacterial vaginosis, sexually transmitted infections, and even adverse pregnancy outcomes. So some really powerful stuff that impacts many, many, many women. So if we take a look at the state of the vaginal microbiome throughout our life cycle, we see there's a strong influence of that lactobacillus, as well as hormones that are really driving fluctuations throughout a woman's life. So prior to puberty, the epithelium and the mucosal layer are going to be very thin because estrogen, progesterone levels haven't begun to rise yet. So there's higher pH, greater microbial diversity. As women enter puberty, this ecology starts to change. It starts to shift. We see more estrogen production. This leads to that greater production of that glycogen fuel. So we have higher levels of protective lactobacillus. We have lower microbial diversity. So here, generally, the ecology is much more protective. It's much more functional. As we move again into peri-menopause, there's a pretty significant decline in estrogen levels, and this contributes to lower production of protective antimicrobials. And then again, as women enter menopause, we see another large shift in hormones and some immune changes that come along with this as well. So we have a decreased resiliency of the vaginal microbiome. And a lot of these are directly correlated with a decline in estrogen. So in perimenopause and menopause, like we mentioned, there's a really significant decline in estrogen, about 35% between the ages of 35 and 50. So we have less lactobacillus, we have a lower production of protective antimicrobials, that glycogen fuel. Take a sip of water real quick. So, all right. GSM, you might be familiar with this, you might not be. GSM is a term used to describe a myriad of different signs and symptoms that can occur in postmenopausal women. And these are associated in many cases with things like vaginal discomfort, vaginal dryness, and just general bother. And these are attributed mostly to a decline in systemic estrogen. And these GSM symptoms, vaginal dryness, even urinary incontinence, affect 27 to 84% of postmenopausal women. And over half of women with vaginal symptoms report that these symptoms really impact and adversely impact their sexual health as well as their quality of life. So we talked a little bit about these changes that we're going to see just naturally throughout our life cycle as hormones change. But what else? What other things are going to influence the vaginal microbiome? Well, if you're familiar with the gut microbiome, one big influencer is going to be diet. Diet has the potential to be either inflammatory or anti-inflammatory, to help to feed either good commensal species or to help fuel the growth of maybe microbes we don't necessarily want to see. Plays a role in estrogen metabolism, hormone production, all sorts of things in our body. And there's also a link between what our gut microbiome looks like and what our vaginal microbiome looks like. So we'll get into that a little bit deeper here in a bit. But diet's a really big influencer here. As we talked about, hormonal changes are a big one, whether those are the natural changes that we can expect throughout our life cycle, or maybe things that we encounter in our environment that affect our hormone levels. We are bombarded currently by things in our environment that can be potential endocrine disruptors, pesticides, xenoestrogens, all sorts of things can impact whether or not maybe we see this decline in estrogen happening earlier than previously. So hormones are a big one. Sexual activity having healthy sexual partners, number of sexual partners, or in some instances, not having sexual partners. All of these things can actually impact the health of the vaginal microbiome. And of course, hygiene, our personal hygiene, as well as the type of feminine care products that we might use. Are we using tampons? Are we using pads? Are we using a Dixie cup? If we're using tampons, are they contaminated with things like microplastics or chlorine? These things will impact the vaginal microbiome. Medications, for example, things like antibiotics that kind of come in and are not very nice to the ecology, destroy a lot of potentially good species. So antibiotic use, medications that can potentially change our pH levels. And one that I know we all encounter on a daily basis, stress. Stress is a big one, and one that I know we all are always battling our darndest to be able to kind of combat this, but stress is a player that we often overlook when it comes to our health and well-being. So throughout a woman's lifetime, most women are going to be diagnosed with some condition that is associated with the vaginal microbiome. The three most common of these, and you might be familiar with them, are bacterial vaginosis, vaginal yeast infections, and urinary tract infections. Bacterial vaginosis is the most common vaginal condition in reproductive age women. It has a prevalence in the United States of a little over 21 million, or very close to 30%. UTIs are the most common outpatient infection, and it has a lifetime incidence of 50 to 60% in adult women. And then 75% of women are likely to have at least one yeast infection during their lifetime, but nearly half of that 75% have two or more. Some additional things are linked with vaginal dysbiosis, such as adverse pregnancy outcomes, endometriosis, gynecological cancers, pelvic inflammatory disease, fertility issues, STDs and STIs, as well as toxic shock syndrome. All of these have been associated to some degree with vaginal dysbiosis. So let's break down vaginal dysbiosis a little bit. So I pointed out what we wanted to see, kind of those protective lactobacillus species, a low pH. But what does this actually look like when we actually go to look at a vaginal environment? So we can classify what a vaginal environment is going to look like with the 5 community state types. So basically, the vaginal microbiome has been clustered by research into 5 potential groups of what we're going to see there. So the first one, community state type 1, is arguably the healthiest state. Here, we're going to see, if you think back to those protective lactobacillus species that I mentioned, here, we're going to see a dominance of L. crispatus. Now, L. crispatus is a particularly protective species of lactobacillus because it creates something called D-lactic acid. D-lactic acid is a very potent, very protective form of lactic acid, also contributes to this community state type having a very low pH. pH is usually less than 4. So this is considered to be the healthiest. This is the sort of the ideal, we could say. Not to say it's not the only healthy state, but it is the healthiest. It is the least associated with disease or complication. We also have state type 2. State type 2 is also considered to be very, very healthy, but we don't see it a lot. It's not particularly common. We do see it, but not as often as we see some of these other community state types. pH is still in that healthy range, about 4.4. And like I said, L. gasseri is still one of those good commensal species that we want to see. Then we have state type 3. State type 3, where L-iners is dominant, is a little bit more wishy-washy. It can kind of go either way. It's sometimes associated with very good vaginal health, and sometimes it is associated with dysbiosis. L-iners, so unlike our L-crispatus that creates that D-lactic acid, L-iners creates L-lactic acid. L-lactic acid is less protective. It doesn't work quite as well at inhibiting pathogens and kind of keeping that pH low like the D-lactic acid. So L-iners is kind of, yeah, it's kind of the middle one that can go either way. It kind of just depends on that individual, but it can transition into a dysbiotic environment very, very easily. Then we have state type 4. State type 4 is our dysbiotic community state type. So here, if you think back to that schematic that we went over, maybe there's a very, very low amount of lactobacillus. Maybe there isn't any lactobacillus present at all. So we don't get those protective antimicrobials. We have a very high risk of opportunistic pathogenic bacteria, fungi being able to live and thrive in this environment. And it's the most associated with things like BV, STIs, endometriosis, and miscarriage. Now we have state type 5. State type 5 is really uncommon. We hardly ever see it, and the research hasn't quite caught up to it yet, but it is still considered to be healthy. pH is still low. We still have a presence of those good commensal species. Now, let's talk a little bit about kind of what I mentioned before, the relationship between the vaginal microbiome and the other organs in the body. So vaginal microbiome crosstalk is referring to the communication of or sharing of organisms, microorganisms in the vagina and other organ systems. And there's quite a few of these. There's a vaginal joint axis, a vaginal oral axis, but the two most studied, the two that we know the most about from research currently, are the relationships between the gut and the vagina, as well as the vaginal microbiome and the urinary microbiome. So how does this happen? Well, this really simple answer is proximity, right? The close proximity of the vagina and the rectum allow for the translocation of species from the gut to the vagina after being shed in feces. And kind of a similar thing happens with the urinary microbiome and the vaginal microbiome. But for example, if a woman has higher levels of L. crispatus, again, that good protective commensal species in her gut, she is going to be much more likely to also have a healthy vaginal environment. And something else that we learned about this relationship, which is really cool, oral probiotics that promote a healthy gut microbiome will therefore also support and affect the health of the vaginal microbiome. So I mentioned that we were going to talk about estrogen a little bit. And so estrogen contributes to creating that glycogen fuel. It also contributes to lubrication, elasticity, pH balance, and protection from pathogens. Now, if you're familiar with any of the Biome stool testing, maybe you've talked about this with Ellen, the estrobolome is a subset of organisms that actually live in your gut. And this contains bacteria that produce something called beta-glucuronidase. And beta-glucuronidase is an enzyme that deconjugates or separates estrogen metabolites that are marked for excretion and then reactivates them back into circulation, into an absorbable form, which increases circulating estrogen levels. And this can, in a non-ideal situation, can lead to things like estrogen dominance. But in post-menopausal women, maintaining good circulating estrogen levels can be really protective for the vaginal microbiome, as well as osteoporosis and cardiovascular disease. But there's a really careful balance that we want to see here. Now, like I mentioned, estrogen has really significant implications for the vaginal microbiome, particularly through hormone signaling, microbial interaction, and that estrogen producing that glycogen. Now, having a low strobilome can be sometimes beneficial for reducing the activation of estrogen if estrogen is too high, but can further contribute to decreasing estrogen levels, which might be a risk factor for some individuals and can potentially increase the risk for things like cardiovascular disease, cognitive decline, osteoporosis, as well as changes in that vaginal microenvironment. One topic that I also want to touch on, we won't spend a ton of time on this, but it's really interesting, fascinating stuff, is the vagina-gut pregnancy axis. The microbiome of an infant is really greatly affected by the microbiome of the mother. And this microbiome is built while the fetus is still in utero, as well as during delivery. If the infant is not delivered by C-section, it passes through the vaginal tract and is exposed to the mother's population of microbes. And additional bacteria are also shared from the mother to the infant during breastfeeding. Now, the mother's microbiome, as we know about the microbiome, it can be influenced by a variety of things: diet, lifestyle, stress, antibiotics, and these influencers carry over from pregnancy through to delivery through to breastfeeding. And the microbiome is really critical for the development of an infant's immune system. For example, maternal gut dysbiosis is associated with certain pregnancy outcomes like gestational diabetes, but also conditions like asthma, eczema, and obesity in the infant. So this is just another schematic helping to explain this relationship. A healthy vaginal environment with that protective lactobacillus dominance can help support a healthy pregnancy by inhibiting pathogens, opportunistic bacteria that otherwise may activate inflammatory or immune pathways and lead to a lower risk of pregnancy complication. On the other end, a higher abundance of pathogens, a higher microbial diversity in general is the risk factor for things like infections, the activation of immune and inflammatory pathways, which can potentially influence the remodeling of the fetal membrane, increase pregnancy-related risks such as preterm labor and even miscarriage. Now, this is a really highly sensitive topic for women, and we're not going to dive too deep on this today. But if this topic interests you, if it's relevant to you or someone that you know, what I would recommend is just take a screen grab of some of these studies and you look them up later, because the relationship between vaginal dysbiosis and miscarriage has been really growing in prevalence. Now, most of these studies have occurred in the last 5 to 10 years, but there's a really strong correlation between the health of the microbial vaginal environment with miscarriage, when this carries well into the second trimester. And miscarriage and pregnancy loss have been associated with lower levels or an absence of that protective lactobacillus, higher levels of pathogenic bacteria like Gardnerella and chlamydia, or with those with a diagnosed bacterial imbalance. And again, the high abundance, those good protective lactobacillus that we love so much, tend to be associated with more successful pregnancy outcomes. All right, so we went over a lot of information there in terms of what dysbiosis looks like, what a healthy vaginal environment looks like. And as we saw, most women are exposed to many different factors that disrupt their vaginal microbiome during their lifetime. So what can we actually do about it? What can we actually do about it? Well, let's address the root causes and why. So we can first actually investigate a woman's community state type using the Biome Vaginal Health Kit. It uses whole genome sequencing for the most accuracy on who is actually living in the vaginal microbiome. So this not only allows us to see an outright infection, but also allows us to understand the environment, the ecology, the resiliency of the vaginal microbiome. Testing allows us to support the overall health of the vaginal microbiome, to see who is there, who do we need to support, and to address vaginal discomforts. Now, this is an example of what the sample report of the vaginal health kit. Once you know what you're looking at, it's very simple to read and to understand. It's just a couple pages in length. So we have a really clear view of who is there, and specifically what percentage of real estate that they are holding in the vaginal microbiome. So, we might have L. crispus present, but if L. crispus is only populating 1% of the population here, that's not really what we want. So we get the whole picture, as well as exactly what community state type the lesion falls into. So this is an example of a very healthy vaginal microenvironment. As you can see, we have high levels of L. crispus, giving us that community state type 1. And then on the right, we see the entire picture of our commensal bacteria as well as pathogens. We get to see if there's any opportunistic pathogenic bacteria that are thriving in this environment. So who is this test for? So this test is wonderful for anyone who has a history of vaginal related conditions, especially because the first line of defense, the first line of treatment when it comes to many of these things are antimicrobial treatments, which can then further disrupt this vaginal microenvironment and potentially lead to recurrent issues. So anyone with a history of these conditions, anyone who has reproductive struggles, women with abnormal endometrial growth, those with a history of hormonal imbalance, anyone suffering from recurrent UTIs or yeast imbalances. And this is also a really wonderful test for those that are looking to become pregnant or trying to conceive. Now, you may have heard of our Biome stool kits before. And so how do you know which of these tests is best for you? I do want to point out that they are very complementary. These tests work synergistically with each other, but for example, the Biome stool test, yes, it addresses GI concerns, but it also looks at multi-system concerns. So for individuals with metabolic dysfunction, autoimmunity, skin issues, or nervous system disorders, this is a wonderful test. It's not specifically just for GI complaints. It looks at broad dysbiosis risk factors. So if you have a history of antibiotics, you don't sleep well, you're stressed, you smoke, consume a good amount of alcohol, this can be a really, really good test for you. It offers functional insight into gut ecology, just like the vaginal health kit. It is doing that whole genome sequencing. So it assesses not just who is in the gut, but what they are actually doing, which enables really targeted nutrition, lifestyle, and supplement interventions. It looks directly at that estrobolome. And like I said, it is complementary to the vaginal testing. For example, we might see a gut origin microbe that is suspected in vaginal dysbiosis. Things like Gardnerella or Prevotella are very often seen in the vaginal microbiome, and they come from the gut. So being able to kind of correlate the presence in both environments can be really useful for targeted interventions. Now, the vaginal health kit is going to be best for those with recurrent vaginal health concerns, UTIs, yeast infections, BV, endometriosis, PCOS, those who would like preconception support, and anyone who wants to take a look at what their community state type actually is. It's going to take into account your hormonal and lifestyle influences, take into account how things like age, sexual habits, medications, stress, diet are affecting your vaginal microbiome. And again, it works very synergistically with the stool test, especially if we do see one of those gut origin microbes present in the vaginal microenvironment. So what can we do? Once we know who is actually there, what can we do about it? Well, we can look at our lifestyle, right? We can practice good hygiene. Kind of just a fun little clinical tidbit when it comes to feminine care products. Currently, the Dixie cup is kind of leading in research, being the most kind of supportive to the vaginal microbiome. So if you like Dixie cups, you'll be happy with that, or Diva cups, you'll be happy with that little bit of information. But practicing good hygiene, good personal hygiene, maintaining a healthy anti-inflammatory diet, so huge, making sure we're having enough prebiotics, polyphenols, healthy fats, reducing our stress, easier said than done, I know, but can really help to promote a healthy ecology. But we can also kind of kick things off by supporting the vaginal microbiome with probiotics. Probiotics are powerful and evidence-based ways to support vaginal health and to restore a healthy vaginal microbiota, as well as reduce the recurrence rate of bacterial or yeast-related imbalances. So I'm really excited to introduce you all to the first women's health products here at Microbiome Labs, our Vaginal Balance and Pregnancy Support. These are two really powerful, really unique probiotics. And we're going to go into the science behind these and how they work in a moment. But they both contain our Astarte blend, which is a blend of 4 lactobacillus strains. Vaginal Balance also contains cranberry, which is a really powerful ingredient that supports the health of the vaginal urinary axis, as well as something as probiotic called LA5. Pregnancy Support contains LGG and Astellos, along with the Astarte blend. Like I said, we're going to go into the science behind what these are and what they actually do for you. So we're going to start with Astarte. So Astarte is a really unique blend of 4 lactobacillus strains that should sound familiar if we think back to our conversation around the vaginal community state types. We have L. crispatus, L. jenseni, L. gasseri, and L. rhamnosus. So we'll review the research in just a moment, revealing how Astarte can help reduce bacterial imbalance in the vagina, as well as decrease digestive and vaginal complaints. So this was, put this up here, a double-blind randomized controlled study looking at the effects of a yogurt drink containing Astarte on instances of bacterial imbalance. So the study included 36 women who had a diagnosed bacterial imbalance. They were given antibiotics, and this was a study of only 2 weeks. So this is kind of important for us to note. It only took 2 weeks of being on these products to see the results. So the researchers were looking at the recovery rate, Amsel score, which if you're unfamiliar with this, if I was as well when I was reading this, it requires at least of 3 of 4 criteria to be present: a pH above 4.5, a thin discharge, a fishy odor, or certain cells that are present on a vaginal smear. So we're looking at the Amsel score, discharge, as well as odor. Now, what they found was the group that has received the Astarte, 100% of them no longer met the criteria for a bacterial imbalance. The Astarte group also saw a 200% reduction in Amsel scoring and significant reductions in discharge and odor. So this was looking at how the probiotics worked synergistically or taken at the same time as an antibiotic. And it was suggested that the probiotics not only help to preserve the lactobacillus species, but also potentially had some biofilm disrupting benefits as well. So this next study that we're looking at evaluated the efficiency of Astarte taken twice a day by pregnant women, and then measuring outcomes that included the presence of Candida species along with vaginal discomfort. What they found was that in those that actually took the Astarte, there was a 200% increase in lactobacilli colonization. And this, in turn, because lactobacillus creates that lactic acid, led to a 58% decrease in women who had pHs over 4.5. There was also about a 67% reduction in vaginal irritation. There was a significant reduction in the presence of yeast overgrowth by about 50%, and improvements in placental sufficiency. So that's Astarte. Now we're going to talk about LA5. So LA5 is Lactobacillus acidophilus. So this was a study using LA5. And this is a cool study because the women actually served as their own control. So for 6 months, they were either given a placebo or the probiotic, and then they flipped. Then they were given the other. And this was looking at elevated candida levels, yeast imbalances. And something that is kind of really cool about this study, it started off, I think, with about 83 women, but a lot of them ended up dropping out because they started off taking the LA5. They were in the probiotic group to begin with, and then they refused to stop taking it because they felt so good. So then they had to leave the study. So kind of a cool little tidbit. But for those who did complete it, they found a 30% decrease in vaginal discharge, a significant decrease in irritation and urinary discomfort, and there was also a really significant decrease in that yeast overgrowth. Now, the aim of this study was to compare the effects of the probiotic with the standard of treatment on recurrence of yeast overgrowth. And here they found that remarkably, the LA5 strains really did improve markers of vaginal health, reduced vaginal discomfort, and supported the reduction of yeast overgrowth with 85% decrease in unwanted yeast growth and a 74% decrease in candida colonizations. All right, so now we'll move into LGG, and there's a really good chance that you've heard about this ingredient because it is the world's most documented probiotic strain. It has over 1,900 scientific publications and is documented in over 250 clinical studies. So it's a Lactobacillus rhamnosus strain, and it's really important for various things such as immune and gut health. Now, this is a really cool study. So we're highlighting a 3-part trial studying the effects of LGG on postnatal seeding on red and scaly skin occurrence in infants. So this was a trial of healthy pregnant women. Half of them received either the LGG or a placebo for 2 to 4 weeks before delivery, and then half of them continued the LGG for 6 months. Then half of the infants were given LGG for 6 months. The infants were then followed for several years, and they were looking at different immunological outcomes such as allergies, asthma, red and scaly skin. And what they found, this stuff's really cool, there was a reduction at 50% at 2 years of age in instance of red and scaly skin, 43% at 4 years old, and 35% reduction at 7 years old. And this was found in both the maternal group and the infant group. Then finally, our last strain that we're going to go over is Acylose. So Acylose is a unique strain of Bifidobacterium longum infantis, and it has a unique relationship with human milk oligosaccharides, and it supports seeding of in the most critical time of an infant's development, the first 1,000 days. So in this study, there was a maternal seeding group and an infant group. The mothers took the probiotic 4 weeks prior to delivery and then continued for 28 days afterward with a washout period. The babies took the probiotic for 28 days with the same 2-week washout period. And with the babies group, there was a 100% recovery of the Astellos in the stool. And for the maternal seeding group, there was a 30% recovery, but a significant increase in the production of butyrate. So what they found in both groups was that the Astellos persisted in the infant's microbiome with stable trajectories, even after the washout period. So that's the science behind why these products are so impactful. They can be so powerful and so useful kind of in the toolbox for improving vaginal health. So who is vaginal balance for? Again, so that's our LA5, the Astarte, in addition to some cranberry. So this product is great for anyone with a history of antibiotic use, those who are experiencing occasional vaginal imbalances, healthy women who have a recurrent or risk of recurrent UTIs, those who are preparing for preconception, those experiencing reproductive struggles, and post-menopausal women who are looking to support their vaginal and urinary health. Pregnancy support is great for pregnant women who are at least 33 weeks pregnant, new mothers who have given birth in the last 4 weeks and are breastfeeding or pumping, women who are generally just wanting to support their vaginal health during pregnancy, and those with a family history of skin sensitivities and want to support their baby's skin health. Also a wonderful product for. So these are tools. These are tools. In order for these to really work to the levels that we want them to, we have to make sure that we are also implementing lifestyle changes. We are taking care to implement lifestyle strategies that will support our vaginal wellness. So one of the most powerful things that we can do because of this crosstalk between the vaginal microbiome and the gut microbiome is support a gut microbiome health. So we can do that through a lot of these same influencers. Maintaining a good diet is a huge one, avoiding inflammatory foods, eating enough polyphenols, prebiotic fiber, healthy fats, reducing stress, regular exercise. All of these are going to support both the health of the gut microbiome and the vaginal microbiome. But we also really want to make sure that we're supporting our estrogen balance. So we can do that by making sure we're supporting our liver, which helps us to detoxify estrogen, to balance our blood sugar and minimize our exposure to things that can be endocrine disrupting. Like we said, exercise, managing stress, maintaining good hygiene, which I know we dived a little bit into, and then making sure that we're having healthy sexual partners as well, because actually another little clinical pearl, sexual partners are one of the greatest risk factors for recurrent vaginal imbalances or bacterial vaginosis. So, all right. I know we went through a lot. I know that was a lot of information. So I really appreciate your attention. I hope you found this information empowering and relevant. So thanks to those who've asked questions so far. But now I'm going to stop sharing my screen and I will hand the mic back to Ellen to bring us into our Q&A time.
Thank you so much, Sarah. That was incredible information and really inspiring. And yeah, wonderful. Really, really wonderful. I'm going to stop the recording now so that we can do a separate Q&A. This recording will be shared publicly and the Q&A will not. So you guys can ask your questions more privately. So let me just stop this recording and we'll start again.